Hi, everyone. Thanks so much for joining today to hear a little bit more about some of the research that we do in the Masters in Animals and Public Policy program. My name is Megan Mueller, and I am an associate professor of human animal interaction at the Cummings School of Veterinary Medicine at Tufts University. And I am one of the core faculty members in the MAPP program at the Center for Animals and Public Policy. And today I'll be talking a little bit about the work that I do and how that intersects with the MAPP program. So the Center for Animals and Public Policy and the Masters in Animals and Public Policy program is located at the Cummings School of Veterinary Medicine at Tufts University, which focuses on a wide range of clinical policy and research areas related to the intersection of human and animal health. This is the Center for Animals and Public Policy, where the core faculty reside and our research labs are in this space. The mission of CAP is that the work conducted by the center is based on the tenets that animal well-being matters, that human and animal well-being are linked, and that we can enhance both by understanding our human-animal relationships. And that's a lot of what my research focuses on. So within the Cummings School, the Center for Animals and Public Policy really drives some of our core curricular efforts around educating students around public policy that impacts animals, including human-animal relationships, and to really foster scientific evidence-based discussions of what this policy might mean in real-life settings. Our areas of focus at CAP are human-animal relationships. So this includes human-animal interaction, animal-assisted interventions, the human-animal bond, and the psychology of pet ownership. And this is primarily where my area of research is. But we also have other faculty members that focus on companion animal welfare and behavior, human-wildlife interactions, and lab and farm animal welfare and policy. So you'll be hearing about these areas of research in other webinars. The goals of the MAPP program are really to focus on animal policy, and that's really what makes this program unique from other programs. Policy includes all the different ways that communities can act collectively, and so we prepare students to really help solve some of the sticky challenges that involve the intersection of people and animals by building analytical research and communication skills, providing exposure to a wide range of both animal issues and potential careers in human-animal relationships, and encouraging students to really understand different viewpoints on given issues. So to start out with my background, and I'll talk a little bit more about what my research interests are and how that intersects with the MAPP program. So I grew up as the sort of classic animal crazy child. This is during my 101 Dalmatians phase, reading to my cat. But as I got into my schooling, I really developed a love for psychology and child study and human development and understanding what it is that makes our brains work and how we interact with other people and what shapes our views of the world in different ways. So my undergraduate degrees were in psychology and child development, and then I went on to finish my master's and PhD all at Tufts. So I'm a triple jumbo. I stayed at Tufts for my whole career and focused in my research lab in graduate school at the Institute for Applied Research on Youth Development, the role of adolescent development, and later on in my graduate work, the role of animal interactions in promoting adolescent developmental outcomes. Then once I graduated, I came on the faculty at the Cummings School to really start to focus on what do we know about the psychology of the human-animal bond and how that impacts our shared health, both our health and the health of the animals that we live with. So I'm at the Center for Animals and Public Policy, and I direct the Tufts Pets and Well-Being Lab, which I'll talk a little bit more about. So my role in the MAPP program is that I teach the companion animal module within our core animals and society course. And this module covers all different topics that relate to companion animals and society. I also direct the Pets and Wellbeing Lab, which I'll talk a little bit more about. I also co-direct the Tufts Initiative for Human-Animal Interaction, and I'm one of the faculty advisors for Tufts Pause for People, which is our therapy animal group on campus. And this is something you can get involved in as a MAPP student. You can do an elective with the Tufts Paws for People program, or even join with your own animal as a therapy animal if you wish. I also mentor MAPP student research projects, primarily in the area of human-animal relationships. So next, I'm going to talk a little bit about the research that my lab does, just to give a flavor for the kind of work that's being done in the MAPP program. So the Pets and Wellbeing Lab is comprised of a hybrid team. So because our lab is based in Grafton, but we also have students from our other campuses. So we have undergraduate research assistants from psychology, child development, biopsychology, occupational therapy, as well as graduate research assistants from the Cummings School and from the medical school. We have a hybrid environment where we can work across campuses and have lots of different professions involved in our research. We also have Ph.D. students on our team. We have DVM students who work with us for summer research, and a number of research staff and a postdoctoral research associate. So we have a great team that's working on several projects that relate to human-animal relationships. We also have lots of collaborations internally across the different colleges at Tufts, but also externally with many different institutions, both locally and nationally, to conduct research in this area. Our current research projects, we have a large study ongoing right now. This is our primary study, the Teen and Dog Study, which is funded by the National Institutes of Health and the Waltham Pet Care Science Institute. And through that program, we're a partner in a multi-institutional PAWS research program, Pets and Wellbeing Study. So this is a longitudinal study of dog relationships and adolescent mental health. And I'm going to talk a little bit more in detail about this study in a few minutes. Then a few other projects we have going on. We have a National Institutes of Health funded study where we are exploring the mechanisms of action in animal-assisted interventions. So what's actually happening when we interact with therapy animals? What are the underlying physiological responses that we have to those interactions? And how can we understand how the shared behaviors between people and therapy dogs impact outcomes in these interventions? We are also working as part of the Adolescent Brain Cognitive Development Study, which is a 10-year NIH-funded longitudinal data set that we have added pet ownership items to. So looking at a large cohort study exploring the role of pets in youth development. So now that I've given a little bit of an overview of what our lab works on, I just want to back up a little bit more and talk about how we define human-animal interaction and what it is that we're actually studying. So the human-animal bond is often defined as a mutually beneficial and dynamic relationship between people and animals that's influenced by behaviors that are essential to the health and well-being of both. And I would say it's not always mutually beneficial, but it's certainly mutually influential. And this dynamic nature of the relationship is something that we really focus on, especially in the MAPP program. How do we understand what drives these relationships? So this umbrella term of human-animal interaction can include all kinds of different topic areas. Pretty much everything we might cover in the MAPP program falls under this umbrella. But today I'll be focusing on my research areas, which are companion animals and pets and assistance in therapy. So the science of human-animal interaction has really undergone exponential growth over the last several decades. This is a graph of the number of citations and journal articles related to human-animal interaction and human-animal bond since the 1990s. And as you can see, the volume just keeps going up. So we have a lot of great research in this area, a lot of high quality science that's coming out. So it's a really exciting time to be in this field. There are lots of different areas of research that intersect with human-animal interactions. So this is just a sampling of some of the things that we've studied or our students have studied, animal-assisted interventions in healthcare and education settings, the mental and physical health effects of living with pets, which is what my lab primarily focuses on, service animals and assistance animals for individuals with disability, the psychology of human-wildlife conflict, caregiver burden and grief from pet loss and pet owners. So really looking at the other side of the bond, what happens when that bond is no longer human and animal behaviors and how our understanding of behaviors might impact the bond, stress and welfare of pets and therapy animals. For animals that are working in therapeutic settings, how do we understand the impact of those interactions on them? And then also, certainly, cross cultural differences in human animal relationships, how these patterns of even something like pet ownership look very different across the globe. So, we really try to take a systems approach to understanding research on human animal interactions. It's not just me and my individual dog living in a vacuum. There's really this bi directional relationship between the person and the animal and the environment that they live in. So, it's really important when we're studying the psychology of the human animal bond that we take into account all of the different factors that could impact this bond, such as family influences, friends, community, environment, and how this all plays out over time. So really the framing questions we are looking at in our research are: for whom, under what circumstances, is human animal interaction beneficial for diverse families? We know these relationships are not going to look the same for everybody in every circumstance. So how do we understand the specific nuances of these relationships? And what are the underlying processes driving these relationships? If we're seeing positive health outcomes associated with living with pets, why might that be the case? And then this allows us to determine how we can optimize these mutually beneficial interactions in real world settings. If we know how to identify when things are going well and when things are not going well, that helps us figure out what can we do to help improve the human animal bond for the well being of the people and the animals involved. So, finally, I'd like to talk about one of the specific studies that my lab is working on, just to give you a little bit more of an in depth look at how we approach designing a research study that focuses on human animal relationships. So, this study, which is called the Teen and Dog Study and has a little bit wordy but longer name of the Longitudinal Assessment of Specificity in Adolescent Dog Relationships and Adaptive Coping for Youth with Social Anxiety. And the purpose of this study is really to focus on how dog relationships can support teenagers with social anxiety cope adaptively with stressful situations. So, why are we focusing on social anxiety specifically? That seems like a very specific outcome to look at. Well, adolescence is this really interesting developmental period where we see a lot of development of autonomy, which means that teenagers are developing their sense of self and their sense of identity beyond their family. So often, what happens during this developmental stage is we see a decreased importance of parent relationships and an increased importance of peer relationships. And while this is a normal developmental process, it can sometimes lead to peer stress. We also know that adolescent mental health is a significant public health issue, especially since the COVID pandemic. Adolescent mental health has been on the top of the mind of many parents and practitioners. Social anxiety is particularly common among adolescents, and if you're going to develop social anxiety, the onset happens during adolescence. So this is a really important time period for understanding and helping to treat and to help youth adaptively cope with this. So why are we studying dog relationships in this context? Well, I know this is somewhat of a complicated looking figure, but really what it's showing is that we know that there are outcomes of dog interactions with youth, such as emotional support and comfort, facilitating social relationships between people, supporting increased physical activity and reduced physiological stress, and skill building through responsibility of care. And these outcomes are linked to known dimensions of positive coping. So, when we are experiencing anxiety or a stressor, there are ways that we can positively cope with this stress, such as seeking support, regulating our emotions, expressing our emotions, perhaps even distracting ourselves positively from that stress. And these are adaptive coping measures, which are preferable to less adaptive coping, such as substance use or rumination or perseverating on the stressful situation. So our hypothesis is that these dog relationships, these outcomes of youth dog interactions that we know to be the case, would help support adaptive coping for teenagers with anxiety. So why are we studying this through a longitudinal study that happens over time? Well, we know that having a pet by itself is not a particularly robust predictor of mental health. Just whether or not there's a pet in the home doesn't actually tell us that much. It's the quality of that relationship and the nature of that relationship that matters. And we have a lack of longitudinal research that's designed to assess what are these specific circumstances that we talked about in this model. We need to understand how dogs interact within the family and what types of family level processes are involved in positive relationships. For example, are there ways that parents are helping to facilitate relationships between dogs and youth in order to harness some of the benefits? So, to tackle this question, we're taking a three-pronged approach. So, the first aim of our study is asking the question, how do dogs contribute to adaptive coping for youth over time? And we're doing this with longitudinal survey data, which means survey data that's collected over multiple time points over multiple years. We are also asking these more process-oriented questions. What are the family level processes that support adaptive coping, and how do these processes change over time? And to do this, we're conducting in-depth qualitative interviews with parents and teenagers about their relationship with their dog. And then finally, we're interested in understanding how interactions with a pet dog might influence our physiological indicators of anxiety. So when we're anxious, we cognitively understand that we are feeling anxiety, but also our body is responding to that anxiety. And we're interested in how interactions with a pet dog might influence our body's response to anxiety. And we're using a methodology called ecological momentary assessment, which I'll talk a little bit more about. So to address these aims, this first aim where we're looking at survey data, we have now over 500 youth parent dyads enrolled in the study, and we are in the middle of year 2 of data collection of 4 years of surveys. So to be eligible for the study, teenagers have to be ages 13 to 17, living with at least one dog. Screening is having clinically high levels of social anxiety. And we are repeating an annual survey 4 times for both the teenager and the parents. That includes demographic information, mental health history, dog relationship quality, so how much they interact with their dog, what that relationship is like. Do they have any barriers to the relationship? What's going on with the dog's behavior? Does that impact the relationship? Also, what other types of support do they have? Peer social support, family social support, their loneliness. And then how are they adaptively coping with stress? So within this data set, this allows us to ask questions such as, how does support from a pet dog support trajectories of adaptive coping over time? So when we're seeing patterns over time, our youth really having consistently high levels of adaptive coping? Are they starting with low levels, but then over time they're getting better at coping? And does a dog relationship interact with that? How are these trajectories impacted by sociodemographics, peer relationships, and family communication or support? So, for example, for a teenager who already has really high levels of social support from their family and peers, do the dog relationships matter more or less? How might individual dog characteristics and behaviors predict trajectories of outcomes? For example, if you have a dog that has some really challenging behavior, does that impact the potential effect that they might have on these outcomes? And then interestingly, are we seeing any differences in parent and youth reported outcomes? Are parents and teenagers reporting these relationships in different ways? In the second arm of our study, we're looking at identifying these family level processes with qualitative interviews. So with 40 parent youth dyads, we're conducting separate interviews, one with the parent and one with the child. and asking questions such as how and why families might choose to acquire a dog, the intentional ways youth might seek out dogs for contact when they're stressed out, strategies parents might use to facilitate teen dog relationships, daily routines with the dog, perceived benefits and barriers to the relationship. How does the family communicate around the care of the dog? And what's the relationship with the dog with all members of the family? So, really getting into a deep dive of what's actually going on in, in these families. And then finally, in the third aim of our study, we're looking to assess, again, how these interactions might impact our physiological responses. So within this aim of the study, we're taking a subsample of 100 youth and we're conducting a 7-day period of ecological momentary assessment. Now, what ecological momentary assessment is it's a methodology where instead of asking somebody globally, sort of, how are you doing generally, like you would in a normal survey that you might administer at yearly intervals, you're asking people, how are you feeling right now in the moment? And then you're asking them that multiple times a day. It gives you a much more precise time scale for how they're doing in the moment. So we're using this app called Life Data, which pings participants every 2 hours from 8 a.m. to 8 p.m. local time across 7 days. And it doesn't take them very long, just maybe 30 seconds or so to fill out these quick items related to dog interactions. Is their dog with them during that time point? What are they doing with their dog? Their momentary social anxiety, how lonely do they feel, and then mood state, are they feeling positive or negative? So we get lots of data points on each participant. And at the same time, they are wearing this wristband called the Empatica Embrace Plus, which looks very much like an Apple wristband, and it's collecting electrodermal activity. Electrodermal activity is an index of sympathetic nervous system activation, which is essentially similar to when you sweat on your palms, when you're feeling nervous, that type of physiological response. And what we can do here is look at this blue line would be the physiological response. We can see what happens when they're notified, when they're responding to the prompts on their phone. And then we can see what's happening physiologically before and after. So this allows us to really look at what types of interactive behaviors can enhance physiological regulation. So it allows us to integrate what's going on with them in the moment, how they're reporting it, with what their actual physiological responses are. So just to share a few preliminary results from the initial data collection from this particular part of the study. We're having very good adherence to the prompts. We're at about almost 70% adherence, which is pretty good considering a lot of our teenagers are in school during the day, so sometimes they can't respond to the prompts that are in the middle of the day. And about 40% of the time they report being with their dog. And that's about, again, what we'd expect considering that they are often at school or other extracurricular activities where the dog is not present. In these initial analyses, we were interested in how enjoyability of the dog interactions. So were participants rating the interactions as highly enjoyable or not very enjoyable? How did that relate to some of their mood outcomes? So we found that enjoyability was positively associated with positive affect or positive mood. So if they were having a highly enjoyable interaction with their dog, that was associated with feeling more positive. We did not actually find any relationship with negative mood, negative affect. But we did find a negative association with loneliness, so that the more they were enjoying their relationship with their dog, the less lonely they felt. So just some initial findings to show that perhaps this interaction with a dog might be associated with how someone's feeling in the moment. And then the next step of this study is we're starting to integrate our different types of data. So just to orient you to this figure, this is just one example of a single day where a participant is wearing the wristband, and these blue lines show the physiological arousal. So these spikes would be increased physiological arousal. The red dots show time points when their dog is not with them, and the green shows when they're with their dog. And then these purple time points are their self-reported anxiety level. So a couple of interesting things we could see here. So for example, we see one of these spikes happens when the dog is not present. It appears as though this other spike also happens when the dog is not present. And these lower periods of physiological arousal happen when the dog is present. However, we also see this interesting mismatch. In this case, this person reported feeling very anxious, but their actual physiological anxiety was not that high. So that shows that sometimes perceptions and the physiological response can be mismatched. This type of data integration, which we can do for every person on every day of data collection, allows us to get at this very precise relationship between feelings and emotions and whether the dog is present. So the practical applications for research like this, we're hoping that we can make recommendations for parents, educators, and mental health professionals around how the integration of dogs into family systems might support youth well-being. And that hopefully we can lay the groundwork for future design and evaluation of interventions that can support families and their dogs. Where it's appropriate and desired by the community, we can identify and reduce barriers to having a dog in diverse families. So, areas such as affordable pet friendly housing are really important policy areas if we know that dogs are impacting health and well being. And then identify the need for interventions to support the human animal bond, such as behavioral support. Again, if we have a family that has a dog with challenging behavior, can we provide supports to help mitigate some of those challenges? So ultimately, the research that we're doing in our lab and in the MAPP program more generally is answering these big questions of how do we optimize the human animal bond to create a more equitable world, and really trying to understand how we can use science to help us create policies that will make the world a better place for people and animals. Thank you so much for listening. And certainly, if you have any questions or follow up, please feel free to email me. Thank you.